Okay, just give me some minutes. We are trying to connect people who will join via the YouTube.
Okay.
Just give me some minutes. We are trying to we are trying to get in touch with people who would join via the YouTube link. So we are going to start in 5 minutes, please. Oh my goodness. I'm going to lock this particular group. They are not joining the YouTube link. They are just making unnecessary complaint on that anti-cancer group. I'm going to close this group now. Okay. I'm going to close this group now. These people are abusing this access. Okay. Please just give me 5 minutes. We are starting very soon. Okay, so we have 100 people here already, and so we'll start officially in 5 minutes time, please. So if you have gut problem, and you have done everything in this life, be it medications, be it please mute yourself. I'm trying to mute everybody, but be it medications, if you've used medications, if you've used herbs, if you've done everything possible, and you've not gotten better, please use the chat box and comment, because today's class is actually going to be a bit I'm trying to cut it to 1 hour, but if we can't finish it in 1 hour, we add other things. So okay, my book is here. So I jotted down some things. The people complaining on WhatsApp that they cannot join, they are not here on the YouTube link now. They are not here on the YouTube link. Okay. Now them sabi. Oh, did she use another link? Okay, I think I copied the link. If you like, let them know join. I'm not going to record this class. Though I said I would record it. I'll record it, but I won't share it to everybody. So the people who have opportunity to join, they better join now. You know, the crazy things about human beings is this. When you see free things, you see 1,000, you see we did the class free, we said registration is free, and we had over 1,500 participants. Now on the Zoom link we have 100 people. Yeah, that one is, we know that 100 is it for capacity. And then I put up the YouTube link where 10,000 people can join. Who is saying no sound? Oh my goodness, there is sound. So we have over 1,500 people. The YouTube link is there for them to join, and no one is joining. We just have 34 people on the YouTube link, and we have 100 capacity here. I'm taking note. This is to tell you that there are people that can never get better, not because it is a curse, but because they don't have the strength to sacrifice for knowledge. And that's why you see people are going to keep buying medications for the rest of their life. So I'm going to kick off now and we start. Hi everyone. So if you're meeting me for the first time, let me introduce myself, and there is a reason why I did not do this on Instagram Space. My name is Chioma Okonkwo, and I am a registered nurse, okay? I am also a doctor of natural medicine, certified in Nigeria to practice in Nigeria, and I'm also certified fruit therapist. So I am the lead consultant of Fruit Clinic Nigeria, the first and the only fruit clinic in Africa, where we use fruits and nature to help sick people. Over the years, we've helped over 1,000 people, yeah, you heard me right, without medication, to cure ulcer, gastritis, IBS, and other gut-related issue. So I'm going to start the recording now.
Recording in progress.
So, today, we are going to be talking about your gut. Most of you here, please use the chat button. Most of you here either have acid reflux, ulcer, gastritis, sleepless nights, depression, anxiety, bloating, constipation, and so many other things. Am I right or wrong? Now, let me shock you. The truth is this. You might not get better with medication. Go and write it down. I want us to interact on the chat box as much as possible. You see this class? Go and ask people who did my gut class. Last 2 years, we charged 20,000 naira for only the gut class. Last year, it was 50,000 naira. And this year, I decided to do it free. And I'm going to tell you why I decided to do it free. Yeah. So the reason why I am doing this class free is to just thank God for the life of my mom, because she survived a very chronic condition that almost took her life. And I vowed to God when I was praying, I said, God, don't let my enemy laugh at me. And then I said, if my mom gets better, I am going to teach people free. And this is the reason why I'm doing this free. Okay? Yeah. So, many people have been diagnosed of ulcer. If you are blood group O, we are going to start from why you have ulcer. So, you will see that 90% of people that are here are blood group O. The link ended at 6:24 minutes. Yeah, who said that? Are you sure? Oh. Just hold on. Let me copy. Is that? No, I don't think so. Please, I don't want you guys to distract me here. Go to the WhatsApp group. You will see the link, okay? For the old link. Oh, inability to. Just hold on. Let me chat my rep to send the new link to all the groups. Just give me a minute. Okay, so henceforth I'm not going to be distracted again. If you need the link, just chat any of my admin, the person that is on admin on the WhatsApp group, and they will answer you. I want to focus on just teaching. So if you are blood group O, start registering yourself now. 90% of people who have ulcer or gut issue are blood group O, and I will tell you why. Okay, but that will be later at the end of the class. Now, for those of you who have been able to resolve gut issues, so let me tell you a bit about my mom. So my mom had ulcer around 2010. Yeah, like 2009, 2010. And I got into nursing school 2011. So we've done everything possible, and there was nothing, she wasn't getting better. As a nurse, after I graduated, I was still doing the same thing, that the medication and everything. And the reason why she had that ulcer was because there was a time she actually did surgery. So during that surgery, they gave her lots of antibiotics. We didn't know that the antibiotic actually displayed both the good and the bad bacteria. So H. pylori got into her system, and that began to eat her up. So she treated ulcer for a long time until I started natural therapy in 2016. And trust me, we were able to manage it properly. Like, she was okay. But we didn't know that, my mom is somebody that normally on a normal day, she has constipation. We didn't know that there has been a build-up of constipation for months. So there is a particular food she ate that now triggered the ulcer. So what happened is that I think her digestive system, one part of the small intestine got blocked. So they had to pass a tube into her system, through her mouth, her nose to her mouth, and then they removed over 5 liters of undigested food. This is somebody that has been okay for years. So at the end of the day, thank God for the doctor. And that's why I'm going to teach you today that there are some doctors that they know what they are doing, but there are some that don't know what they are doing. So at the end of the day, we were able to, when she left the hospital, we were able to manage it. And then she's a learned person. She makes research a lot. And we were able to see where the problem was coming from. And that was when we got to know that even if your ulcer is already cured, you need to pay attention to what you eat. So this will now lead me to talking about ulcer. The major cause of ulcer is H. pylori, yes or no? Please, I want you guys to be answering me so that it will be very interesting. And ulcer does not affect only old people. It can affect from 2-year-old. The major cause of ulcer most time is H. pylori, right? Good. And some people might have gone to the hospital, and they'll tell them, oh, there is no H. pylori, but yet you are still feeling that ulcer symptom. Why? This leads me to teaching you that your gut is your second brain. Please write it down. Your gut is your second brain. And if you are blood group O, your system naturally is acidic. That is why as a blood group O, you can actually digest meat and proteinous food very well. But if you don't eat the right food, you are going to have issues with acidity. And no matter the kind of medication you take, it will only relieve you a little. But when the pain comes back, it's going to be crazy. And even your antacid, taking your antacid all the time can actually cause you what they call kidney stones. Your omeprazole can predispose you to stomach cancer, and I'm going to explain why. So you see, this class is not for me to say, oh, come on, not just for teaching you recipe, but also teaching you the side effect of your medication so that you will be empowered. Omeprazole, what omeprazole does is this. Please listen, because I'm going to go into science a bit. I will come down to your level. Just listen to me. Your stomach is the most acidic environment in the body. I want you to know this today and know it for peace. Your stomach is the most acidic environment in the body. So your stomach is supposed to be acidic in nature. But do you know the problem we have? The problem is not your stomach. The problem is your LES. Everybody say LES. Yeah, wherever you are, if you don't say it, you will forget it. LES, less. Say less. Less. That LES is called lower esophageal sphincter. Your esophagus. You know your esophagus, right? The lower part of your esophagus. There is something called sphincter. Don't get complicated, because if you don't understand this, you will not know why you're always having acid reflux. Sphincter is like, let me get something to practicalize. Good. Okay, let me get this. Sphincter is like a closure. Look at this. Sphincter is a closure. It can open and it can close. Please listen very well. When you eat a food, your digestion starts from your mouth, yes or no? Your digestion, when you put food in your mouth, you chew your food, it gets into your what? Your esophagus, your larynx, your pharynx, into your esophagus. When it's going to empty into the stomach, what happens? The sphincter what? Opens. Are you with me? When the food enters the stomach, your sphincter is supposed to what? Close. Are you getting me? That's the way God created the body. But let me tell you what happened, especially for those of you that have taken omeprazole. What happens is that when you eat, because you've already used omeprazole to lower your stomach acid beyond its level, this sphincter is supposed to respond to a normal pH of your stomach. For example, my children, if the pH of the stomach is supposed to be 3, and because you have used omeprazole to lower the stomach acid, the stomach acid is already reduced, so the pH has increases. For those of you who did science, the lower the number, the more acidic the environment. Yes or no? Good. Because you've already lowered the stomach acid with omeprazole, the sphincter will not be able to close properly, so there will be a little opening. And at the end of the day, what happens is that when you are supposed to be resting, there will now be escape of food from the stomach. It will now bypass the esophagus and enter your throat. That is why most of the time you feel acid reflux, and sometimes you have what they call mouth odor. Because that food that has entered your stomach before, it will now escape through that sphincter that is supposed to get closed. And the sphincter is supposed to what? It's supposed to respond to the acidity in your stomach. So if your stomach is supposed to be 2 pH acid, you now took omeprazole, it now reduces your stomach acid. What the sphincter is waiting for, the sphincter will say, okay, I think the stomach acid is not enough, so the sphincter will still be open. It cannot close. And then before you know, there is an outflux of food. No matter how much you lower the stomach acid, if a food escapes from the stomach and enter any part of the body, there is problem. That's why sometimes you think you are having heart attack. It's not heart attack, it's chest pain, it's reflux. Sometimes the food can escape to any part of your body and it can start burning you. That's why people who have ulcer, sometimes they will tell you that they have throat pain, they have headache, they have back pain. Back pain. Ulcer can actually cause that, even arthritis. So the first thing I want you to understand today is not about the herb you want to buy, the supplement you want to buy, the food you want to get. The first thing I want you to understand today is your LES. If you can actually focus on that LES, you are okay. Eh? Okay. You are actually okay the moment the LES can close after you eat. But the reason why most of you that have ulcer, your lower esophageal sphincter will not close because number one, you have abused omeprazole. Your stomach has left the acidic medium to being alkaline. And that is why you will continue to feel bloated, because the function of acid in your stomach is to digest food. But because you have reduced the stomach acid, you are not able to digest food properly. That's why you burp all the time. And when you burp, it smells. Because the stomach, they did not digest food. So all the food in the stomach is rotting. So, people say you don't need stomach acid. It's a lie. The only thing is that you need your stomach acid to be in the right pH. Because too much acid can actually it can cause erosion of the stomach. And this is the reason why we are going to be teaching you things that when you eat, it doesn't reduce your stomach acid. It maintains and preserves the stomach acid so that you can digest food and so that you will not be bloated and so that your stomach or your gut can give you what you need. That LES, we have explained it. Now, I am going to explain another thing that your doctors don't tell you about. It is not because they don't know. Some might know, some might not know. How many people have the time to come and be teaching you the way we are doing? There's no time. We are busy. The next thing I will be teaching you about is why is it that all the people that have ulcer don't sleep well? They are always depressed. They have anxiety. If you have ulcer and you have anxiety and you have lack of sleep, please put it on the chat box. I want to count the number of people so that I'll be able to know where to touch. And then I will tell you why most people who have ulcer always feel weak. Some of them say they have low blood. Now, let me tell you why you have anxiety, why you have ulcer. Let me see. You see this class, if you are able to help yourself with your gut issue, 75% of your health problem is resolved. Now listen carefully. I want you to know something today. Your gut is your second brain. Your gut is connected to your brain. And I will tell you why. Your gut produces almost all the neurotransmitters you have. What are neurotransmitters? Neurotransmitters are just, we call them electrical nerve that help us to what? Pass information from the brain to all parts of the body. So, neurotransmitters, most neurotransmitters are responsible for your mood. When you are very happy, most neurotransmitters are responsible for your depression. For example, we have neurotransmitters, they call it serotonin, they call it dopamine, serotonin and dopamine. The reason why you are always anxious and depressed and moody is because if your gut is not healthy, if you don't have good bacteria in your gut, these neurotransmitters, if they are supposed to be produced by 100%, they fall down to 5%. So every little thing, you are irritated, you are angry. Even as a man, you don't know why you can't sustain erection. You don't even know. You are taking drug and you are almost running mad. When you go to the hospital, some doctors can even tell you that, okay, I think you should see a psychologist because I think you are just deceiving yourself. Because they have given you all the drugs and you are still complaining. Ulcer can run you mad. So in your gut, when you are supposed to produce neurotransmitters that will make you happy, every time you are sad, even those of you that said they are doing business, when customer enter your DM, you are angry. Any little thing, you're already angry. It is not your fault, my sister. It is your neurotransmitters. And it's because the omeprazole you've taken, the antacid you've taken, the antibiotic you've taken, they keep on depressing your nervous system. So any little thing you say, you're always scared. You're always anxious. Any little thing you're crying. It's not your fault. It's not because you are a terrible person. It is because your gut has been, your gut bacteria have been displayed. And that is why you see most children, if you're a mother here and you are giving your children antibiotic all the time, please stop it. You are killing that child. And that's why you see most children now have autism, because their gut is leaky. If you have a child and you want to improve the brain of your children, focus on their gut. Focus on the things that help, which we are going to be talking about today. But I want to tell you why you are feeling the way you are feeling. It's not because you are going crazy. It's because of your body. Now, aside from the anxiety, let's talk about why you don't sleep well. Melatonin is the hormone that is responsible for good sleep. Okay, we have serotonin. Melatonin is also for your skin. But at the same time, there is a little that also helps for sleep. But guess what? Because your gut is not healthy, these things cannot be produced. So at the end of the day, you are having restless nights, you go and buy insomnia medication, you are not sleeping well. The worst part is people that now have mouth odor. You have used all the toothpaste in this world. You have seen a dentist. You have gone to spa. It's not your fault, though. It's not because you are dirty. You are not dirty. When your gut is not healthy. See, where is this thing I'm using? Hold on. I want to describe something for you. Okay, I've seen it. So it's like a pipe. So your digestive system is like a pipe. Okay? This is the mouth and this is the anus. Two opening. If this pipe is not going on well, it will affect this pipe. So if you have gut issue, you don't go to toilet well, you don't move your bowel well, you have rotten food in your intestine, it can come up and then you start having mouth odor. So most of your children, every time you be flogging them, your mouth is smelling, you did not brush. It's not their fault. It's their gut. So please, I want you to know that today, most of the problems you are having is as a result of what? Your gut issue. So medication will not help you. Medication can only help you to actually relieve the symptom, but it can never cure you. The only way you can get your cure is, number one, to tell yourself that yes, you are ready to be cured. Number two is to be open-minded. And that's why you are in this class today, because we have over 1,500 people who registered. And just 1,002 people are here. Okay? So the first thing we need to do, we have two categories of people. We have people who have this problem already. And then we have the next people who, they are already getting better, but they are on medication once in a while. So we are going to be talking about 10 principles, okay? 10 principles of helping your gut. If you don't have biro, go and get biro. If you have a recorder, go and get a recorder and record. Because if you come to the class and tell me, Fruit Nurse, can you repeat it? You pay me 200,000. That's the worth of this class. If you think I'm joking, go and ask any of your medical practitioner. No matter the endoscopy you go for, no matter the medication you go for, gut problem, medication cannot solve it. It is only your diet and you that can solve it. Now, if you have, let me assume everybody here have ulcer, okay? So the first thing I want you to know is your bed. Your bed. So if you have acid reflux, all you just have to do is that go to the head of the bed, that the two line, find something to lift it up, or you use pillow. That automatically will help you to empty your food properly into your stomach when you eat, especially at night. So you need to elevate the back of your bed. So what I'm doing here is I'm going to teach you things that you don't need to buy anything first before you enter where you will now be buying some fruits and other things, okay? So elevate the head of your bed. You see that most people at night, the reason why you don't sleep well is because when you eat and it doesn't get digested, how do you want to sleep? How do you want to sleep? Elevating the head of your bed helps you to empty your stomach content properly. It helps you to what? Empty your stomach contents properly. And that gives you the room to sleep. For those of you that are on your video on the Zoom, thank you very much. You're helping me to make this thing very interesting and very interactive. So, looks like I'm talking to human beings. So, I'm very, very appreciative of that. Kelechi, Rosemary, thank you so much. Okay, just a minute. So, the next thing we are going to be talking about, how do you chew your food? Most of you are the cause of your problem, but you don't know. Let me tell you how to chew your food. Digestion starts from the mouth. So this is what you do. Why you give yourself problem is that when you eat food, you just swallow. And guess what? The work that your teeth and your tongue is supposed to do, you will leave the work to your stomach. So what happens is that your stomach will now be overworking itself. So when you eat your rice, when you want to eat rice, you chew your food, count it at least 10 to 15 times. Chew it very well. You are helping your saliva to digest that food first before your stomach digests it. And that's what helps you to digest food properly and not to overeat. Do you know that if you eat a cup of rice, if you chew that cup of rice very well, and you bring 3 cups of rice, if you don't chew that 3 cups of rice very well, if you eat the 3 cups of rice, it will look as if you are not filled up. But if you chew that 1 cup of rice very well, trust me, you won't eat much and you are okay. So sometimes overfeeding can actually cause you problem. So the first step after raising the head of your bed, the second thing is to chew your food properly. If you are somebody who eats swallow, and you know that you cannot chew your swallow, make sure that you've blended that swallow very well. Things like oats that has fiber is okay. But if you are eating that swallow, let it be small, obele, like some people, if they want to eat swallow, they will carry everything, throw the eba, then they swallow it. You cannot get better that way. So if you want to eat swallow that you cannot chew, you take it small, small. And you take enough soup. So you chew your soup. What you did is this. You are preparing the brain. Now look at this. We are very practical. If you are eating, suddenly, if you are chewing your food while you are eating, do you know that the brain is telling the stomach to prepare hydrochloric acid to digest the food before the food enter your body? But if you don't chew your food, you just carry the food, there is no time for the body to balance itself, to say, hey, stomach or food is coming, please prepare yourself so that you can digest this food. But you just swallow the food straight, it just gets into your stomach. So the stomach will now be slow, will now take time to digest. After it digests, you will now absorb it. So the second principle is chewing your food very well. The third principle, because we are going to do practical, all of you that have health issue, by next week, you will submit what you've done and how your health has improved. Because it's all these small things. You don't need to buy products to get better now. The third thing is never drink water while you are eating. Don't try it. Don't try it. Please, if there is one thing you will learn today is never drink water while you are eating. It's either you drink water 30 minutes before or 30 minutes after. Or if possible, say 10 minutes or 15 minutes. But drinking water, especially if you have ulcer or you have any gut-related issue, drinking water while you are eating is going to destroy your system. Now, let me tell you why. God created the stomach to be able to what? To digest your food. And that was why he put hydrochloric acid. HCl is responsible for digesting the food. When you are eating your food and you drink water, the moment you drink water, the HCl will hold on because water is already there to digest your food. When you are done eating, the HCl will be released. And that is why some of you have pain after you've eaten. So the HCl release, and then there is no food to digest, and then it begins to eat up your stomach. So your brain has already told the stomach that a food is coming, but you now ignorantly drank water while eating. So when you are done, when the HCl is now being released, it will now, there is no more food to digest, so it will now eat up the stomach mucosa, which we call the stomach lining. And that's why some of you will say, you are having pepperish sensation around your stomach. Bring him. Bring him, come. You are having pepperish sensation around the stomach. Someone said, what if you are eating bread and tea? Oh my goodness. Someone said, what if you are eating bread and tea? Oh, okay. We will get to that. Don't worry. We will get to that. So, that's the third principle. So, don't drink water while you are eating. Drink water 10 minutes or 15 minutes after you have eaten or before. Anyone is okay. Okay? Now, the next thing is, okay, deep breathing. Deep breathing. Someone is asking me what about juice. Don't worry, there'll be time for question. Let me finish this session first, okay? Deep breathing. I will tell you why you should do deep breathing. Most of you are spending millions on things that you're not even supposed to spend 1 naira on. Anxiety can be caused by a lot of things. But let me tell you something. Your ulcer symptom can be worsened by stress. Yes or no? Your ulcer symptom can be worsened by stress. Check yourself. Most of you that have ulcer, you will see that it is when you are very stressed, that's when the pain comes up. So one of the ways to reduce your stress and to help your anxiety is through deep breathing. And how do you do deep breathing? It's very simple. You just sit down, just relax your back somewhere, close your eyes, open your mouth, and then you inhale air. Like, let it be so deep. You can do that 10 times at once or 5 times. And you can set alarm and do it like 2 times a day or 3 times a day. This deep breathing can reduce pain for you. Try it and see. These are non-conventional methods that I'm teaching you. Okay? Then, what is the next thing we are going to be talking about? Avoiding some food. But before I talk about avoiding some food, I'm going to give you a particular food that if you have ulcer and you are not taking, I'm sorry, you will continue to spend money on medication. Who can guess that food? I know some of my students here who have attended my class. I don't know what they are doing here. They are okay. I don't know what they are doing here. I don't know. Who can guess the food? Oh, someone said pawpaw because I put pawpaw. Someone said cabbage. Hey, story. Someone said... Okay, so that we won't waste time, one of the food that every ulcer patient, whether you like the food or not, is pap. Please write it down. P-A-P-O-G. Pap. If you've not been taking pap, it's either maybe you don't have an idea of it actually, or you don't just want to help your life. And I will tell you why. You see your gut. Somebody say custard. Now omelette. Pap. Not custard. Not whatever. Pap. Because even your custard that you have, the tetrazine in custard, can cause cancer. That yellow thing they use in coloring it. So go and check it. So if you are in abroad, you can make your pap yourself. All of you are saying abroad. Am I not in Canada? See, it's snowing here. Look at it. It's easy. Just go to Superstore or any place you want to go to. Get your corn. We have fresh corn here. Get it. Get your corn. Go to YouTube and look for how to use that corn to make pap. I did not say you should buy pap. You can make it yourself. You can ferment it. When you ferment it, use your blender to blend it. It's very simple. Look at YouTube and do your pap. So being abroad is not an excuse. Why do I recommend pap? I'm going to tell you the reason why I recommended pap. I hope I was recording this. So okay, good. Good. Why am I recommending pap? So one of the major things, I'm going to come to that question. I'm going to come to that that's O positive and con. Okay, don't worry. We will get to that when we are asking our question. Let me finish my lecture. Okay, now the reason why I recommended pap or any fermented food is this. When you, most of the time, most of us that were diagnosed of ulcer later, we have abused antibiotic without knowing. So what the antibiotic did is that it killed both the good bacteria and the bad bacteria. So the function of pap or fermented food is to help you give your body what they call probiotic and prebiotic. Please note the difference. Pre, P-R-E, biotic. Pro, P-R-O, probiotic. Prebiotic is the food for probiotic. But I'm going to explain that later, okay? Now, your pap actually contains both of them. That's why I recommend it. And this thing, they encourage good bacteria in your guts. And that helps you a lot to now what? To now produce all the things you actually need for your healing. So probiotic is very important. So how do you take your pap? If you are not taking the corn pap, you can do the millet pap. For those of you that say you can't take corn, you can do the millet pap. And when you are taking your pap, you make sure that you put honey. The reason for the honey is that when I was a nursing student in University of Ibadan, most of the wound, the deep wound, we use honey to dress it. If you get original honey, especially Nsuka honey or very original honey, and you use it with your pap, I am not here to joke. I gave you 1 month. If you follow every step that I'm teaching, if you don't get better, then just know that I am not who I said I am. These things are practical. There is medicine in food. You just have to try. So pap and honey. So the next thing I'll be talking to you about is this. What are the things that you should avoid if you have ulcer or any gut problem? If you go to milk, you are killing yourself. You don't have business with milk. If honey aggravates your ulcer, it means the honey is not original honey. I can guarantee you of that. They put sugar. And that sugar, because sugar causes inflammation, that is why you have pain. So I think what you're buying is a brown sugar. Brown honey, brown sugar that they roasted and then became honey. Okay? So, honey and pap is very good. Okay? Now, I hope you are jotting down. We are talking about so many things. But I'll finish it. The next thing we'll be talking about is this. Henceforth, if you have pain, if you have infection, before you use antibiotics, be very careful. For pain, if you have pain, avoid medication like diclofenac, all those NSAID medication, because most of you, the reason why you have ulcer is because you have been in pain since and you've been using pain medication. You don't know that your pain medication can actually cause you ulcer. Pain medication like diclofenac, they call it NSAID, NSAIDs, non-steroidal anti-inflammatory drugs. They work for pain well, but the side effect is that they can actually cause your stomach they can cause wound in your stomach. And for those of you who don't know here, if you have ulcer actually is like a risk factor for stomach cancer. And this is the reason why I am working this hard and giving all this information, because stomach cancer is on the rise. We have a lot of people who have died of ulcer. Ulcer can cause you bleeding. So be very careful. The next thing I'm talking about is okay, so we've talked about probiotics. You can get probiotic from pap, but I want to talk about one of the most powerful probiotic that when I teach today, everybody should go and start and make tomorrow. It will be ready in next week or so. So they call it sauerkraut. Everyone write it. SAUKRAUTT. Sauerkraut. I don't know if I got it, but if you put it on Google, you will see it. Sauerkraut. Someone should look out for the spelling of sauerkraut and put it out for us, please. Sauerkraut is made with cabbage. It's a fermented cabbage. Yeah, thank you. SAUER. Yeah, sauerkraut. Good. So, good. Sauerkraut. Now, if you notice what I've been talking about, I said that when you have gut issues, a lot of things can go wrong in your system. And what I'm trying to do for you guys is to encourage the growth of good bacteria, such that when you replace the good bacteria in your gut, it will help you a lot. Now, you see that all this while I've not mentioned any product. So even if you want to buy supplements in probiotic, you might not get the results you will get if you do the original one made from fruits, okay? So you can check the video on sauerkraut. After this video, after this thing, go and check on how to make sauerkraut. But I'll just explain here. It's very simple. So you get your cabbage. You can get the white or the purple. You can start with one, and then you get salt. For those of you who have hypertension that cannot use salt, just use a little amount of sea salt. Do you understand? Just use a little amount of sea salt, and then you squeeze the, when you bring cabbage, cabbage has a lot of water. You use that small salt, and then just one cabbage, you start with one. You squeeze it, cut your cabbage very well first, wash it very well, cut it, and then you match it, use your hand to squeeze it. At the end of the day, You immerse it inside the water of that cabbage. Make sure that the water is covering it. When you are doing this thing, please use a glass cup or glass plate, like a ceramic plate, okay? So after you do it, you cover it. Make sure that every day you are checking it and making sure that the leaf of the cabbage is inserted into the water. If you see that it is not inserted, use your spoon to push it in. So you leave it for like 3 to 5 days, okay? After 3 to 5 days, it is ready. You can add a tablespoon to your meal. You can add it to your smoothie. You can eat it that way. What you are giving your system is this. You are giving your system fermented food, okay? And fermented, this Zoom will end soon, but the moment it ends, join back. But the life will still be here. This one is 1 hour. The moment it ends, just rejoin back. So the fermented cabbage is to help your gut. And when your guts have enough bacteria, what happens is this: they begin to produce more electrical impulses. So automatically you start feeling better, your mood is better, and you sleep better. Okay? Then the next thing I'm going to be talking about is dangers of medication. I've talked about it. Try as much as possible when you have that very bad pain, even if you are going to take your antacid, don't take it for up to 2 weeks. Don't take it for long. Just take it to relieve yourself, okay? So the next thing I want to be talking about that most of you don't even know is this. I'm going to talk about 2 things together. I'll talk about positive affirmation, and then I'll talk about sunlight and magnesium. So I'm talking about 3 things together, okay? So most of you, the reason why you get sick is because every time you wake up, you say, I have ulcer. Every time you are always prophesizing negatively into your health. So I want you from tomorrow, when you wake up, you look yourself into the mirror and say, I am going to be better. My body is the temple of God and I'm going to be healed. One experience I've had over the years with my practice is that those who actually speak positively, they get better faster. Okay, so try and speak positively into your health, and whatever thing you are taking, just make sure that if you serve juju, pray to the juju. If you serve God, pray to the God. So the cocoa is that have somebody that you pray to. So the next thing we'll be talking about is vitamin D and magnesium. Good. So vitamin D, you people are so lucky in Nigeria. You know, you have sunlight. Here, see snow. We don't have sunlight here. What we have here is snow for like 7 months. So what I do is I take vitamin D supplement or CMOS, okay? But if you're in Nigeria, early in the morning, try and expose yourself to sunlight. It will help your mood a lot, okay? It will help your mood a lot. Pay attention to this vitamin D I'm talking about. Magnesium, there are 2 ways to help yourself for magnesium. Now, listen carefully. Check your antacid. Tomorrow, everybody check your antacid. You will see that most of your antacid contains magnesium. Am I right or wrong? Check your antacid from tomorrow. And those of you who have it closed, you can check it. Most of your antacid actually contains, oh, good. Aha. You see, gastro. Most of your antacid contains magnesium. Let me shock you. When you are taking magnesium too much orally, it can actually cause damage to your health. So the best way to take magnesium, someone is asking me antacid. Antacid are medications that they give to people with ulcer to reduce acidity or to reduce pain, okay? So one of the best way I'm going to teach you how to get in magnesium to help your gut health is through Epsom salt. How many of you know Epsom salt? Epsom salt. Good. Epsom salts, you see, back in those days, our grandparents used those things a lot for their health. So one of the ways you can do Epsom salt is sometimes, when you get back from work, while you are watching your TV, just put like 2 tablespoons of Epsom salt in warm water. Just put your leg inside, be watching your TV. Your body is actually, absorbing the magnesium. So automatically, do you know that your skin can absorb a lot? And that's why you see people that are bleaching, they have risks for kidney failure later in life. Your skin is so powerful. For those of you that your children have cough, if you want to help them at night and wear them socks like this, and then you cut onion, slice onion and put it under their feet. You do that for 1 week, the cough will disappear. That is because onions are very powerful. They have antiviral effect and they can get absorbed into the skin. That is why some of you, if you hold aloe vera, or you cut, if you are cutting aloe vera, you can taste it on your throat. So the skin is very powerful. So magnesium therapy, Epsom salt, can help you to absorb what? Magnesium. And remember, we are talking about guts. You see all this thing I'm talking about, all the things you know, but you've not been doing it. So I've talked about that. The next thing I'm talking about is self-massage. You guys are supposed to pay me 1 million in this class. So the self-massage, why do we talk about self-massage? Do you know that some of you, since your mother gave birth to you, you've not gone for massage? In fact, most of us are just living by the grace of God. Self-massage, you don't need anybody to massage you. When you bathe, why do you need self-massage? You need it for blood circulation. So that when you massage yourself, it helps you to take blood to all parts of your body, and then you can relax well. And even you people that have high blood pressure, it can also help you. So the best way to do self-massage is this: when you are bathing. Most of you, you bathe wrongly. 5 minutes, you don't bath, you don't come off for bathroom. The best way to bathe, before you use sponge, rub your soap on your hand and use it to massage your body first before you use the cream. If you do this, if you start doing this night or tomorrow, you will see that there are some part of your body that you don't know you have pain on, but you actually have pains. So try self-body massage. After you finish bathing, that soap, your soap is not just meant to wash your body. Your soap is also meant to lubricate and what? To massage your body. So that soap, apply it, use it to massage your body very well before you use the sponge. After you finish bathing, go and buy Ori. Go and buy Ori or whatever Vaseline you are using at night. Use it. If you are rubbing cream, those of you that are rubbing cream, you want to rub cream, you just rub it. Let me drop this baby. I need to. Where is my wrapper? Okay. Those of you that are rubbing cream, when you are rubbing cream, you don't know how to rub cream. Rubbing cream is not just like this. You bring out the cream and then rub. No. You rub and massage your cream into your body. You get your cream. You see this place. What you are doing is you are helping your body for blood flow. Okay? And that automatically, when you have enough blood flow, there is also good blood flow to your digestive system. And that can foster healing because your blood contains oxygen and what? And nutrients. Okay? So self-massage is very, 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 very important. All these things you might not start immediately, but it's something that you should be doing once. Now, the next thing is seasoning cubes. Most people don't react to seasoning cube, but some people react to seasoning cube, and this is the reason why we encourage you to do more of natural spice. Okay, natural spice. And I want to encourage you guys, okay, when you are doing your spice, I want you to focus more on efirin. You people know scent leaf, right? Efirin and chang. I think Igbo people call it on chang. Yeah, Igbo people call it on chang. So I want you guys to, whether you are cooking soup, stew, rice, if you have gut issue, and chang is very good for the guts. Very, very good. And then your garlic. Let me tell you how to use your garlic for food. Most of you use garlic very wrongly. If you want to use garlic, especially if you are treating ulcer, pound the garlic or blend it and then leave it for 15 minutes so that it can release what they call allicin and sulfur. Then before you can add it to your food. Garlic is one of the most powerful prebiotic. Now, probiotic feed on prebiotic. Okay? So garlic are very, very good, but you need to match it and leave it for 15 minutes before you add it to your food. Okay? So natural spices you can get from people you trust, and then you're good to go. Now, I have just one thing to talk about. When you are taking your smoothie, Some of you don't know how to combine your food. I've been Maggie free for weeks because of your anti-cancer class. Okay. Now, some of you don't know how to what? To combine fruit. You want to take smoothie and then you just blend, you drink. Now, listen to me. If you're taking smoothie and your gut does not have good stomach acid strength, you will be bloated. You will be bloated. So I will advise you that when you want to make smoothie, start with one fruit first. When you start with one fruit, blend one fruit first before you start combining different kinds of fruits. Do you understand? Before you start combining different, start with one fruit. And I will encourage you, when you are drinking your juice, your water, your smoothie, drink it slowly. Allow your saliva to mix with it before you take it. Okay? Now, the ogbonge of all ogbonge, Simos. Please, everybody write it. S-E-A-S, Simos, yeah. The white crafted. Make sure it's white crafted. They call it Irish white crafted Simos. Simos. Now, the reason for Simos is because it contains 92 minerals. There is no supplement that can beat Simos. Go and quote me anywhere. I got to know about Simos 2015. And it has been saving life. So, Simos are very, 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 very good. And I think with all those few points, what I would only encourage you to do is this. Please, whether you like it or not, your gut is your second brain. And then I need you guys to avoid fizzy drink. You see fizzy drink, all these minerals, please avoid it. Avoid it if you love yourself. Not because it's not good for ulcer, but because it can actually predispose you to cancer. If you use some of this fizzy drink to clean your toilet, you will see how clean it is. Please be careful. Avoid fizzy drinks. If you want to drink, coconut water is one of the best friends you should never joke with. Coconut water and cucumber juice. That cucumber juice, you must add honey to it. The cucumber juice, you must add honey to it. It helps you a lot, especially when you are feeling hotness of the stomach. It helps a lot. So for the Simos, you can take it in gel form. You can take it in gummy form. It has over 92 minerals, and that Simos can change your life, especially for those of you with constipation. Okay? So now I'm going to allow for any question you want to ask, and I would use 30 minutes to 1 hour to answer the questions. But now, if you know that you want to get products, now in Fruit Clinic Nigeria, we have products like Ulcer tea, we have Simos, we have natural spice. But when it comes to guts, I don't just sell products. So what I do in my class is that we have a paid class, that we make sure that in 2 months, 3 months, we will stay with you. And we make sure that you get better. Go and ask. We have reviews. Over 95% of people who we have helped have gotten better. So we have a 3-month program. That 3-month program, what we normally charge is 100,000, but we discounted it for 25,000, and we are going to be giving you free gut tea. Yeah. For anybody that signs up for it, you are getting free gut tea, and you are getting a free delivery anywhere in Nigeria. So these are the only thing we do for people who want to do the gut program. And yes, our gut program, we don't do it anything less than 12 weeks. So you are in that group, you are getting a free plan, you are getting a free gut tea, you are getting mentorship, you have 2 therapists there that if you have anything, they are always there to answer you. Okay, and we only have slots for 50 people. We only have slots for 50 people, and this ends today. Me, I'm not even going to stress itself because I don't even have strength for that. So, but that aside, if the 50 slot ends, the rest people pays the 100,000. So the GOT program is 100K, and it comes with tea. But for just 50 people who are registering first, it's only 25K, and you get free tea, you get your free delivery, and then I said, and I quote me anywhere, if you join it in 3 months, just make sure you owe us a video testimonial. In 3 months, you are going to be free. You see that thing that you've been treating for years? You will be free. But whether you sign up or not, just make sure that all these things I taught today, pay attention to it, and then you will see the magic that fruit will do for you. As I said, I am not supposed to have this class for this year, but I decided to do it because of the challenge my mom had, and these are the things I did that, helped her. Then the last thing I wanted to talk about, I think I was supposed to talk about this in my class, in the paid class, but I'm going to talk about it here. Warm water therapy. I need to leave you guys to go and sleep soon. Warm water therapy. If you have ulcer, never ever try to drink cold water at night. You are killing yourself. Okay? So now I want us to start asking our questions. And where is the chat room? Let me go to the chat room. Okay. So start asking your questions, and we'll see how we go about it. Someone said, please drop details. Don't worry. All the tests will be on WhatsApp. Okay? So we have, I think last year, was it last year? Yeah, last year we helped over 500 people. Yeah, we helped over 500 people, and the mistake we made was that we didn't collect video testimonial, but we have so many people, that have testified to it. And it's the reason why I don't, if you come to me and say, oh, I have gut issue, I don't like saying come and buy products, not because I don't like to sell, but if you buy a product today and you eat the wrong food, my dear, you will not get better. So that's why for the gut class, I always advise for program is better. You get to know yourself, and our gut classes is from 4 weeks to 12 weeks. So the food to avoid, it depends on your blood group, and that's why when you join the program, like the 12 weeks program, we don't give general plan. So we use your blood group. So for people who are O positive now, we always advise that they stay away from oranges, whether you have ulcer or not. But then sweet lemon will benefit you. You understand? So that's it. For the sauerkraut, you can check YouTube. You get the answer to that. Someone said, what are the things to avoid? I said, you must not take milk. Milk will cause you problem. As you grow older, you actually have what they call lactose intolerance, okay? And you don't tolerate milk very well. So as an adult, I would advise you not to take milk. If you have to take milk, let's say things like almond milk or tiger nut milk, and there is a way you take it, else you will be bloated. Okay? Else you will be bloated. So someone said, I take this. Oh yeah, so if you take medication, pain medication because of some pains, and you still suffer some ulcer issue, that's why I will encourage you to, do that 12 weeks gut program. It's going to change your life. And for those of you who feel, okay, you don't have the full payments, yeah, there is instrumental payment plan. So there is no excuse, okay? Someone said, Ma, why do I feel my chest palpitation, yet medically nothing is seen? Good. So that was what I said from the beginning, that if you are actually if you have ulcer, so many things can happen. You can feel palpitation. You can even feel like you have heart attack. It's part of your gut. So the best spice combination, don't worry, for this spice, I'm not really an expert in spice combination. So in the 12 weeks gut program that we are going to be having, what we want to do is that we would bring someone that is a good spice formulator to come and teach us. So that's what I plan to do. Someone said, can we? No, Greek yogurt is better. You can do Greek yogurt. For parsley and celery to the cucumber juice, I will not advise at the moment until when you know that, oh yeah, your gut, it can tolerate it. Because sometimes celery can also cause some issue. And that's why some people parboil their celery. Do you understand? Yeah. Panadol, no, Panadol is not a non-steroidal medication. You can take plant-based milk if you know it doesn't cause you bloating. Is Epsom salt therapy good for BP patients? Of course. Apple cider vinegar is good, but if you take it at the wrong time, it can burn your throat. Especially for those of you that have acid reflux a lot. Do you understand? It can burn your throat. Okay, so if you didn't get to know how it was used, maybe when you rewatch this, when you rewatch it, you'll be able to say it. So someone said, how about aloe vera? I'm going to reserve aloe vera for a particular set of people. And these are people who have burning sensation around their throats. I'm going to reserve that for them, okay? So, please, in all of this, just hold on. Someone said, please, what can we take if we are on antibiotic presently and are lactose intolerant? If you are lactose intolerant, see, let me tell you something. When it comes to guts, now, you see all these things I gave to you here? Look at it. All these things I gave to you here, it will help you a lot. But you can't take raw purple. All these things can help you, okay? Just give me a minute, please. Let me drop this. Yeah. So, sorry for the break. This boy is awake again. So all these things can actually help you. All the things I mentioned, okay? So for those of you asking, oh, what can this person take? What can this person take? My dear, I will tell you something. If you really are interested in healing your gut, I think I need to back this boy now. If you are really interested in healing your gut, what I would advise you is you have to go through a process, okay? And that process is not a one-day thing. So what I would advise you is sign up for a gut program. No, cabbage juice cannot help you. There are some category of people. A minute. There are some categories of people that cabbage can help. But the truth is, cabbage juice, okay, might not, because you might actually get bloated. Cabbage juice requires stomach acid for it to be digested. That's why most people, when they take it, they have pains. Some people, they have indigestion. Do you understand? So they have indigestion. So I will encourage you that there is a way we prepare our cabbage juice. There is a recipe I shared on my page. But aside that, there is also a secret ingredient and recipe we normally give to our patients. You get, that one is paid for. And these are part of the things you are going to be getting in the gut program. Do you understand? So this is 10 p.m. and I think we have been able to. So I'm going to leave that group. I'm going to open the group on the WhatsApp, and then we'll send the link maybe by the end of this, maybe by tomorrow or next tomorrow. And then for those of you who have questions, you can ask your questions. Do you understand? You can now ask your questions. So someone said, is ginger tea good for ulcer? Well, it's good, but there is a phase that you cannot take it, else it's going to cause you burning. It's going to cause you burning sensation. Do you understand? It's going to cause you burning sensation. What about eating time? Now, the truth is that all these questions you people are asking, what about eating time? You are going to get it in this gut class that we are going to be doing for. So imagine I'm going to be your footnote. If you are to pay a medical doctor, per consultation is 10K, right? Now, if you have ever booked consultation with us, 1 hour is 10,000 naira for online. Good. So now imagine me trying to help you on your journey. And please, I'm going to drop contact for the person you can buy the CMOS from. And trust me, even if you don't want to sign up for the program, start with that. And your life will never remain the same. Trust me when I say this. And don't forget, you see chewing of your food. Don't joke with it. Drinking water while you are eating, don't joke with it, okay? But at the same time, if you have GERD, esophagus issue, stomach wahala, if you take advantage of this particular slots that I'm giving out for people, instead of 100K, you're paying 25,000, and I'm giving you a free tea worth 15,000 naira. It's a big deal. And then you know how delivery can be now in Nigeria, 3, 5, 4,000, and I'm giving you that. It means a lot. Do you understand? So, and then you are getting a plan, and you are having like 2 specialists in that group that will be able to help you out until you get better. So we are with you for 12 weeks, and you are paying just 25,000 naira. Only 50 people. The rest will pay the 100,000, and I'm not joking. Okay, so I think this is 10 p.m. now, and I'm going to open that group. Whatever question you have, send it there. The ones I know that I can answer, I will. And then the other one, what I will just do is we talk about it in the paid class. Yeah, for the vitamin B12. Thank you for reminding me. Now, the reason why most of you are weak is because you don't have enough red blood cell. And that is because in your stomach, you need HCl that will help you to what? Metabolize vitamin B12. Vitamin B12 is actually needed for red blood cell production. If you don't have enough stomach acid because you've taken omeprazole, there will be reduction in vitamin B12 production. And when there is reduction in that, what happens? There will be low blood circulation, anemia will set in, and you don't even know why you're always anemic, but you are always having anemia. So these are the little things that when you're with us for 3 months, I will even reduce it to 2 months. You don't even need to be with us 3 months. 2 months, 8 weeks. You're going to be teaching you what to eat for your blood group. And for those of you who have children too that have this gut issue, please, I think you should enroll them. Okay? I think you should enroll them. And then if you have people with IBS, we don't treat irritable bowel disease with the same way we treat ulcer. And we don't treat ulcer the same way we treat gastritis and GERD. That's why your plan is never the same. Do you understand? So I think that's just it. And then in the class, you're going to be learning how to sleep, the best position to sleep, coffee enema, how to actually detox your colon. And I will now teach you, look at this. I will now teach you how to know your stomach acid level using baking soda. So these are the things that you'll be learning. Okay, so guys, I think whatever you've learned today, just go and start it. You don't see whether you pay for program, whether you don't pay for program, I will survive. But one thing I am telling you is, if you are drinking water while you are eating, it's a problem. If you're always taking omeprazole, antacid, don't kill your kidneys with kidney stones, especially the antacid. Okay, the last but not the least, antibiotics for your children. Yeah, I have a bonus for you guys. For your children that are always having antibiotics, I'm going to show you a product that when you use it, if that product is always in your house, I guarantee you will not visit hospital in 3 months, 6 months time. So, and not visiting hospital will drastically now reduce the rate at which you give your children antibiotics. Okay, so, and for women who are always having recurrent infection, we will also tell you the products to get so that you don't keep abusing medication. Okay, and for those of you that your children have been having stomach pain, if you're going to join that program, we are going to give you a recipe that you'll be giving to your children, and I tell you, go and check our record. Okay, you will get better. There is power in food. It just depends on how you make use of it. Okay, so on this note, I am going to sign up, and I'm meeting you in the WhatsApp group. Okay, so make sure that tomorrow you do your deep breathing, and then you do your positive affirmation. You don't have to do everything at once, one step at a time. But now you know why you are always sick. Okay, so guys, ciao ciao, and see you in the WhatsApp group. Bye. Oh, okay.